Thank you very much, Presiding Officer. I'm so disappointed this afternoon. I'm disappointed because our health service has challenges. There is no doubt about that. But for the Labour Party to bring a debate to the Chamber this afternoon, completely ignoring the impact of the coronavirus and what that has done to our NHS, and also to come here attacking this government and completely failing to point out the inadequacies of the Westminster government, including the Trustonomic budget that led to what Mark Drakeford described as taking a sledgehammer to the economy and public service. Both of these things have had an impact on the NHS in Scotland too. And we have big challenges to face. But some of the things that have been said about workforce planning and about people working, well, to Conservative colleagues and to Dr Glahani, the control of the pensions rules that have made it financially unattractive for retired health service professionals to come back and support the health service, that's not in the control of this government. That's in the control of the NHS. No, I won't take any interventions. That's in the control of Westminster, who could have changed that pension. They're quite ready to come forward with the Section 35 orders and things we want to do here. How about fixing the pension situation so that the retired doctors and doctors who will be willing to come back can do so at financial benefit? And what about the immigration system?
Dr Glahani, please, we need to listen to the member who has the floor. Excuse me, Dr Glahani, I said we need to listen to the member who has the floor. Thank you very much indeed. Ms Adamson, please continue.
And what about the immigration system, the hostile environment that makes it less attractive for people to come here? Brexit in itself has made people think twice about coming to the UK. But I have spoken already in this chamber, and I'll say it again, about the plight of Sudanese health workers who have gone home or were in Sudan at the time of the conflict, unable to bring their families here, unable to come back into the country with an elderly relative and stuck in Egypt and Dubai. People that work for our health service who have been denied the opportunity to help their families at a terrible, terrible time of need. Where are the Tories on fixing that to make it more attractive for people to stay and be able to come and work here? That's a shocking indictment of what the UK government is doing in terms of immigration. And we wonder why we can't recruit people. I'm not going to take any interventions, sorry. It's a very short speech this afternoon, a very short time.
Members, I've already said we need to listen to the member who has the floor. Thank you. Ms Adamson.
Now, Labour, I understand their concerns. I think we all understand the concerns for the NHS. But it's simply not possible to ignore what their own ministers have said, what their own ministers, the concerns they have raised about, including the Welsh Health Secretary Morgan, who recently blamed chronic underfunding from the UK government for making the management of the Welsh NHS extremely difficult, and called last winter the most difficult time in the history of the NHS. That is also felt in Scotland. That has also been the conditions our own health workers have been working on. And I do think we need to work harder. And the Minister has said, and he's pointing out how hard he is working to ensure we still have the best paid health workers in this country, that we can protect things like free prescriptions, free eye tests, things that people value in Scotland. And it would be really nice if the Labour Party for once could put a bit of criticism onto the UK government and their failure to support the NHS here and in Wales. Thank you.